welcome to our second quarterly measurement and improvement call. Thank you all for calling in and being here with us today. Just a reminder, this call is designed to present on a specific topic by the clinics and held quarterly by OPCA. So the call topic today is how to collect and track data outside of an EMR. And just one more note before we get started that everyone is muted, but I will unmute you in Q&A. So just a few logistical items. We have about 5 minutes Q&A at the end of the call. Feel free to type through the chat box, and then we will discuss this at the end. There will be other points of discussion, so the Q&A at the end is not your only opportunity for questions. And then just for those who may be new to the call, a little bit about our association. So the Oregon Primary Care Association provides assistance to Oregon's federally qualified health centers. So if you're an FQHC on the phone, we are here to support you with your needs. We learn from, educate, and influence health policy at the state and national level. And our mission is to of primary care to achieve health equity for all. Before we get started, I'd like to present to you today. So again, we will be talking about how to collect and track data that may not be easily obtained from your EMR. So with that being said, we hope that you of the 7 key steps to successful measurement. We also hope that you are able to value stream mapping may help assist you in your data collection needs. We hope that you learn to create and apply an effective data collection plan, as well as identify possible ways to track, analyze, and report your data. The topics we also merge some lean methodology with best data collection practices, and many of the tools and examples that we provide today will be available for download on our website. You'll also see a few slides that have hyperlinks, and you can access the information through those links as well. So I just want to start a little bit about the fundamentals of data collection. Data collection is a way of ensuring that you're asking the right questions and looking at what's really happening in any specific process rather than what you think is happening. It's really a way to verify or disprove that you may have. And also, an initial data collection plan is helpful baseline for you to benchmark your performance. So if you're doing some kind of performance improvement project, it's a good way to get a baseline. So by asking the right questions, checking your assumptions, gathering baseline data, you'll build a strong foundation for data. It's also important to recognize the measures that you can use in your data collection process. So the first is a process measure, and then there are various parts or steps in a system or performing in a plan. An example could be % of patients whose blood pressure was taken at each visit, so the process that happens. The second type of measure is an outcome, and that just indicates impacts the health and well-being of patients or possibly impacts on any other stakeholders. An example could be the percentage of patients whose blood pressure reading was consistent. So the outcome is a blood pressure of 140/90. And then you have your balance measures. And this is just a measure that helps you determine if changes in your system affect your system. So an example could be patient satisfaction. If you are decreasing your visit types, from 20 minutes to 15 minutes, you might want to measure patient satisfaction to see how that has been impacted with that decrease. There are some popular data collection methods. So the next couple slides will outline those as well as the advantages and disadvantages of each. I won't be going into detail of all the information on the slide, but I do, however, want which is existing documents and data. So example documents could be UDS reports, OHA, CCO reports, census data, maybe your patient charts. So it looks like we're getting some feedback, so I'm going to pause.
Yeah, it sounds like there's someone coming in and logging in and out of the I'm sorry about the 3 seconds. And I don't know who it is. It seemed to be, so I apologize for that. I'm hoping it's going to go away soon. But do you hear that? Yeah. Unfortunately, it's nothing we can control at this moment, but let's just keep pressing on.
Okay. Hopefully that gets. If it doesn't, please feel free to type in the chat box and we'll address it again. So again, there's the existing documents and data, which is a helpful way to access data and that you don't have to, get yourself. It avoids duplication process. And then there's observation, which I'll be talking about later on. So I won't do that. And then here's another few popular types of data collection methods. So interviews, surveys, focus are ways that you can delve in deeper into some qualitative data. And then you also want to try and think about which is the most appropriate method for your specific aim. So you want to think about, is there a method questions that you want answered? You'll want to think about whether the chosen method will gather reliable or credible data. You'll want to look at maybe which method seems least intrusive. So if you're dealing with sensitive patient information, that's something to consider. And then you also, another consideration is what types of stakeholders or customer groups may access the system. So looking at the advantages and disadvantages that are listed on each slide might help you consider some of those and figure out which is the best method to choose for your data collection process. So we have the 7 steps to measurement, and these are outlined by the NHS Institute for Innovation and Improvement outside of the UK. And it's a really good framework to follow when you're doing data collection. So in summary, you want to first decide your aims. What process are you looking at? Where do you hope to go with the process? You want to choose your measures or specific data points, as well as define those measures. And the 4th step is to create a data collection plan. And this is just a way to get everybody on the same page about the data collection process and be really clear about what you're collecting. The 5th step is to analyze and present the information to stakeholders, maybe your team or other staff members. And then you want to review all the data with your team or project team to make sure that you're getting what you need out of it. And if you're engaging in improvements in an improvement project, the last step is to repeat. And this would be repeating steps 4 through 6 as needed until you get sufficient data to make sure that your improvements are on track. I won't go into too much detail about deciding aims. This was covered in the last quarterly measurement and improvement call. If you weren't on that call, feel free to click on that link or contact us for more information. For this presentation, I want to start with the step of choosing your measures and how you go about doing that. So one tool that can help you choose your measures is a value stream map. This is a way to look at the flow of information and possibly material in any given process. It helps you look at the process objectively. How does that process flow in the current condition, and possibly what issues are you or your staff experiencing when you're conducting that process? It's also a way to identify possible baseline measures that you may need in order to determine what you should focus your attention on as far as data collection is concerned. So some of you may not be too familiar with the value stream map, so I just want to quickly explain the components of what this is. It's different than your typical process map or flow chart in that it gives a broader range of information and more data than just a visual representation of the general workflow. Your process boxes, and these are essentially just high-level steps that you take within your process. You may see some upside-down deltas, and these indicate any delays that occur between each process or high-level step. And then you have your issues, sometimes referred to as storm clouds. And this just identifies any particular issues or problems that you or your staff is facing in any given step of that process. So just to quickly illustrate this, I want to use the example of cooking dinner. Everyone knows how to cook dinner, a general process for that. So when I cook dinner, I first want to prep my raw food, which includes washing and cutting your veggies, maybe defrosting your chicken, gathering your spices. And then maybe I get a knock at the door. So there's a delay between from when I prepare the food to when I actually can start cooking the meal. Once I start cooking the meal, I have to gather all my cookware. I begin following the recipe. But as I'm cooking, I realize that I lost my recipe. And then it takes a while to actually prepare the meal, so there's another delay there, and there's an issue that I have to solve. And then finally, once it's all said and done, I can serve the meal, I plate the dish, I tell my family. And then there's the issues that you see in the yellow storm clouds. So the first one I experienced as I'm preparing the raw food is I don't have the ingredients. So that's an issue that I potentially have to solve or collect data on. Then the second issue is the fact that I lost my recipe. So that's another issue that I might want to look at. Now that I have a full picture of the actual process and the issues that I'm experiencing in that process, I can then begin deciding which issue I want to prioritize first, or which issue I might be most beneficial for me to start collecting some data on. So within healthcare and within all the processes that we have, sometimes there's a long list of issues, and it's really hard to determine which issue you should focus on first. So one tool that can help you do that is a decision matrix. This is just a tool that helps you organize a set of options and objectively prioritize them based on a certain set of criteria. So again, I'll use the cooking dinner example throughout the whole activity, but I'll try to explain this concisely just so you get a picture of how to use it. So first I list my issues. The two I identified in cooking dinner are that I don't have an ingredient and that I lost my recipe. Then I have to choose a rating scale. So I will choose 1 to 5, 1 being the lowest and 5 being the highest. And this will become hopefully more clear as we move on through the activity, but I will caution you to use the same rating scale throughout the activity rather than trying to change it, and also be very clear on what you mean by the lowest and what you mean by the highest. Next step is to choose the specific criteria, and these are criteria that you're rating your issues against. So for this example, I chose how much of an impact on my time will it be to solve the issue, and how much of an impact on the taste of the meal does the actual issue have. So once I decide the criteria, then I weight the criteria. And this is just the relative importance of that criteria. So in this case, I subjectively decided to weight the impact on taste as much higher value than the weight of the impact on my time. So in other words, you can look at it as the impact of the taste of the meal is 4 times more important to me as the chef than an impact on my time. So once you have all of that, then you can actually begin rating your issues against the criteria. So for the impact on my time, I rated that I don't have an ingredient as having a high impact on my time, so I rated that as a 4. Meaning I have to go to the grocery store, which is 30 minutes away, I have to find the ingredients, and I have to come home. Whereas losing the recipe has a relatively small or low impact on my time because I can just look it up online. Then I go to impact on taste. So I rate the impact of not having the ingredient on the taste as very high because this ingredient is particularly important for this meal. Whereas losing the recipe has a slightly, very low impact taste on the taste because I can, figure out what to do with the ingredients and still make them taste good. Once I, once I have those ratings, then I multiply that rating by the weight for that criteria, which you see in the smaller font below. And then once you're done with that, you add up all those values into the total. And the idea is that the issue with the highest total is the one that you want to prioritize first. So in this example, not having my ingredient is clearly the one that I should prioritize in collecting some data on and potentially solving before determining the how I can solve the issue of the lost recipe. So I hope that was clear, but if you still have questions or concerns, feel free to contact me. There is a link below that has an outline as to how you can use this as well.
Or add it into the chat box, too.
Or you can add it into the chat box and we can address it for the Q&A. I'll also be sending out a video which will help outline the process as well. So that'll come after in the follow-up email. So before into the next step of the measurement process, I want to go ahead and turn it over to Evelyn Seibel. She's the Master Trainer at Lean Healthcare West, located in Portland, Oregon. She has a Lean training and consulting background and has worked with over 140 organizations, including healthcare organizations. Recently, she taught a course at Central City Concerns Old Town Clinic, where she did a value stream mapping activity with them. So she'll go ahead and present on one of the value stream maps from that course. Evelyn?
I need to unmute her.
Are you there?
Okay.
Looks like she might be having some technical difficulties.
Hello?
Evelyn?
Hello? Can you hear me?
We can hear you now. Great.
Okay, I was going to say I was unmuted from my side and I could hear you, but I didn't know what was going on your way. So.
Yeah. Perfect.
Okay, perfect. Right.
So go ahead with
I just don't have control of the slides.
Yeah, so just let me know when you're ready to advance and I'll go ahead and advance them.
Perfect. All right. Hello, everybody. So what we're going to look at right now is a value stream map from one of the registration processes at Old Town Clinic. And we're using this actual example so that you can see how to apply this in real-life work. So the value stream that's on here is one of the registration processes. And as you'll look across, as Akira pointed out, the value stream steps in the process are high-level, check in with the patient, verify the customer, those types of things. And then under each box is, of course, listed what are the exact activities that happen within that box. So if it's whether check on demographics, update the client's profile, those types of things go inside of there. And then those upside down triangles, which indicate waste, are what happens in between any time we're spending some value with the patient. So the data collection on this specific value stream was collected by observing the process. So first and foremost, anytime we go to collect data, especially around our value stream, because we're trying to understand the current state, we aren't trying to understand what's supposed to happen, we are trying to understand what's actually happening, so that when we decide to start problem solving, we're applying those problem solving methods on the actual issues that are happening, not on things that we think are wrong, but what is really going on with our flow in our clinic registration process. So first of all, you will do some observation around the process steps, get clear around this is exactly how registration happens. This is how much time each step of the process takes, and this is how much time is spent in between each process. So even though I might come into the clinic and I have face-to-face with the registrar, I register, do my work, or give them all the information that I need, then I have to go and sit down before they call me to the next step. So then any of that time in between there is wait and waste time. So for instance, on this first box says it's taken 1.5 minutes to just do some verification, and then I have to wait for 4 minutes. Then I get to go to the next step, and it takes them 2 minutes, and then I wait 2.5 minutes. And as you can see that flow all the way through there. So the important thing to think about when we're looking for data is several things. One is, what's the applicable data to the process that we're looking at? So in this registration process, it makes good sense to look at how much time it's taking me to actually perform the critical to function activities, and then how much time it's taking just to wait around to have those critical function activities performed. So if you look in this process, it's telling us we only have a 3.6% value on this, which means we're spending way more time waiting than we are doing productive work. So with that, then we say, okay, where is our highest point of return on this map? So if we look at where we have the system access is not clear, there's some sort of review going on there. There's like a 1,200-minute wait time in there. So we want to start drilling down into that and start doing some very specific problem solving, whether it's an A3 problem solving methodology or a PDSA, in order for us to better inform what's the root cause of that wait time. So the data collection in this specific instance is around timing. It's around how much time is it taking us, how much interruption is there. And so then we can begin to understand that flow and attach the data to it to help us decide where are we going to get the best return on our investment of time in our problem-solving activities. So, Akira, do you have anything else you want me to talk about on specific to that value stream before we move to the next slide?
Nope, I think that was perfect. Thank you.
So under the value stream map, understanding the issue, so here we have registration forms should flow and match the database system. So, and apparently they're not. So that's one of our issues, and that's one of the things that's taking us the longest time and it's causing the biggest delay. So in order to really impact the value for the customer on this, we'd like to decrease that time. So we might use an A3 to understand root cause. And when we get to that root cause section of the A3 on the problem analysis, we can ask why many times. And we want to drill down. When we say ask why, we ask why, and then we ask it at least 4 more times to really drill down to a root cause. There are times when just asking the why isn't getting us where we need to go. We may need more information. So we may then use a cause and effect fishbone diagram to brainstorm all the different things that are causing this. Is it training? And if it is training, what about the training? Is the training not given? Is the training not working? Is, you know, all those kinds of questions we might want to do. And then out of those root causes, we may say, you know what? I think let's try this training methodology for this group and see how that goes for our next incoming group of registration clerks. Let's do this, measure the outcome, and then let's look at the data once again and say, okay, did this training make any difference in our value stream? Were we able to decrease that humongous wait time down? And if we were, you know, maybe what was the cause? So not only do we examine what data we have on our very first go-around, then we drill down even further with a very specific problem-solving methodology and look at data again, because we want to measure what is success and how do we know it's improved. Then we want to go back and look at it again so that we can see, okay, yes, we decreased it, but you know, we only decreased it by 5 minutes. We still have 100 minutes that we could decrease. What else can we try? So that gets us into then our PDSA cycles around that. But unless we have clear direction, clear idea of what the data looks like, and a clear idea of where we want the data to go, everything we do is just a guess. It's just based on feeling. It's like, well, I feel it's better. It's better for me, so I'm happy. So yeah, this is the one we're going to do. That's not what we're looking for. We're looking for measurement to show that we're actually making a difference in our patients and our customers' wait time. So that's all I have on that slide. Is there anything else you want to address around data?
Evelyn, can you just talk a little bit about the importance of, like, on an A3 or root cause analysis, for example, of getting baseline and understanding the background data?
Yes, thanks, Akira. I will talk about that. So when we do, if we're using an A3 problem-solving methodology, we're also informing ourselves as to what is the current status. Why is this important to us? So when we look at that initial value stream, you can see right off the bat that, hey, we have a really long lag time between two of those steps. So what does that currently look like? We might go and then focus. We've done our direct observation around the entire value stream. And our next step might be to go and look at some very specific observation around just that section of the value stream. So we would want to look at just that piece of it and do some more observation there to get a baseline of what's really going on here. What's the current training process? What are we currently doing that is informing us and is causing, potentially might be information that will help us to understand why it's taking us so long. But we do need to go back and really look at what's happening in that current state and to drill down into that. So that background information, that baseline data is very important. I mean, because if we move forward and we say, okay, we did a countermeasure, we did a quick test, and now it's only taking us 500 minutes. But we don't know what it took us in the first place. So we don't know for sure that this is an improvement, right? So we need to have that baseline data to do our comparison. So it's vital for us to have some understanding when we start to look at these problems is to step back, because our initial impulse, because we're human, is let's just hurry up and go and fix it. But you know what? We need to really examine what's going on before we jump in and fix it, because two things. One, we want to make sure we're fixing the right thing, and we want to make sure that we're understanding the full scope of this. Because as we move into that value stream, we also want to make sure that by fixing that, we haven't unfixed it for someone else. So there's a lot that goes into that baseline data and consideration. A lot of times when we're doing these activities, as I said, we always have a tendency to want to do it really quickly. And once we understand the background, we can move it forward quickly. But we do want to make sure that we've got all the information before we start making some decisions. And then that will inform us much more clearly and give us a lot more data and around measurement, which is what we're really trying to do. Did that answer your question, Akira?
Yes, that's perfect. So I think if I'm understanding correctly, Evelyn has to sign off. So I want to just briefly give people an opportunity to ask her some questions if there are any. And I've unmuted everyone, so feel free to speak up or type it in the chat box.
And I'm confident that you'll be able to answer these questions as well, Akira, as they come up towards the end. So.
Cool. Well, it doesn't look like we're getting any in, so I want to thank you, Evelyn, for coming on the phone and explaining the value stream map and data collection. So if anyone has any questions. Yeah, so if anyone has questions, feel free to type them in the chat box and we'll address them later, and I can always connect with Evelyn if we need some clarity.
Great, thank you.
Thank you.
All right, bye-bye.
Bye. So it brought to my attention that some of you may not know what a root cause analysis or A3 problem-solving process is. We do have some information on our website about that and how to conduct that process. But as always, feel free to contact me or Krista if you need anything, and we can probably connect you with Evelyn as well. So just know that that's an option if you're not quite sure what that is. All right, so moving on into the presentation, I want to focus now on how you define your measures and creating a data collection plan to begin the data collection process. So why data collection planning? Well, it's essentially data collection planning needs to have clear, useful, and meaningful measures. It needs to have appropriate data with an appropriate, reliable method for data collection. And it needs to have a clear pathway for communication so that everyone involved understands what that plan is. So all of those aspects will create a strong foundation for any data collection process, regardless of what it is that you're collecting. So you want to make sure that you're, just 3 things to keep in mind. You want to make sure that you're using useful, meaningful, and reliable data, that the data collection is a standard process to reduce time or failed or repeated attempts, and then again, just creating a pathway for communication. This is just a template that we created here at OPCA to assist you in the data. Can everyone hear me now? Yeah. Okay, I think we're good. So I'll go ahead and go back to the beginning of the slide. So data collection planning is essentially just a way of ensuring that you're using useful, meaningful, and reliable data, that you have a standard process so you save some time and reduce failed or repeated attempts, and then just a way to create a pathway for communication and shared understanding. So when you're looking at the measures that you've chosen, you'll want to consider creating a data collection plan so that you have a clear pathway for moving forward. This is just a data collection planning worksheet that we created here at OPCA. There's a lot of information, so I'll just point out a few key components that you should keep in mind when you're using something like this. So first, given the measures that you've chosen for your process or specific projects, you want to be clear about the questions that you have around those measures. So what are you hoping to learn from the data points? What are you hoping that it will tell you? That's something that will help frame your data collection plan. You also want to be clear on how you're defining those measures. So is there a specific characteristic that defines that, or is there a numerator and denominator? And you also want to be clear on your method or source of data collection. So is there a particular data source like UDS that you're getting it from? Is there a specific way that you'll be collecting the data? You also want to be clear on your communication, how you're going to be reporting that information, and how you're going to review the information. So the reporting is really a way of gaining shared understanding and communicating with the larger organization, whereas the reviewing is something that you conduct with the team to determine if you're getting the data that you need, maybe if there are any gaps in the data that you need to collect, and discussing what worked well or what could be improved for the next round of data collection. The website has this template on there as well as instructions and examples that can help walk you through the process. So going back to the idea of your method of data collection, there are a few types of data collection sheets that can help you with that. So one that I really like is called a check sheet, and this is helpful in determining a frequency or pattern of events. So say, for example, the registration clerk is getting a lot of interruptions or phone calls when they're registering their patients. So you might want to look at the types of phone calls that they're getting, or maybe if there's specific times of day that you want to specifically analyze and determine where that issue is occurring. There is a template that you can use for this as well. And then there's an observation sheet. So going back to the concept of value stream mapping, this is a good way to determine cycle times, maybe how long it takes you to complete a specific step. And it also could be a good way to determine if there are any variations in the process. So maybe one staff member does it differently than another staff member, and then that begins to, beg the question as to why that's happening. So this is just a sample observation form. Again, there's a template online that you can use. So the one thing I want to point out is that you want to be clear on your start and end point. And this is mostly because if you're observing multiple people, you want to make sure that you start observing them at the same point in the process. That reduces any possible variations or any confusion about what exactly you're observing. And then you can observe each step in the process, determining maybe what issues they experience in that process, as well as the time it takes, and then possibly get the total cycle time for that. Just a couple things to note when you're using observation as a method is, one, you want to either ask for permission or let staff know in advance if you are going to be observing them. Sometimes stress or nervousness can cause variations in the process that wouldn't normally be there. You also want to remember that this is an objective look at the process. So to save any questions or assumptions or concerns until after the observation period, you don't want to interrupt them while you're observing because, again, that'll create process variations that wouldn't normally be there. And then another thing to keep in mind is that you can use an observation form for what I call non-observable processes. So if maybe you're not actually observing a person, but you want to look at timestamps of when data was entered into a system or when you're receiving particular emails and how long it took to answer them, you can use an observation form to track that information as well. So before I move on to the next step, I want to hand it over to Krista, and she'll lead you in a discussion.
Hey, everyone. Yeah, so we have a question, the main question that we wanted to lead a little bit of a conversation on along, and we'll go ahead and unmute you all. And there's a couple of you on the part of your position. You spend really the vast amount of your time, so I'm thinking Vicki, I think Jesse logged in, Aaron from Siskiyou. A lot of you guys spend significant time either developing reports or really diving into the world of data. So the question really for everyone is, how do you go about documenting, or what method do you use related to collecting data for your clinic? Open-ended question. Share your thoughts.
Yeah. Well, this is Jesse from Alpine.
Hey, Jesse.
Hey, so for our clinic, we have a set of workflows that kind of standardize. Some of them come from Ochin, some of them we've written ourselves. Sometimes Ochin will help us get a field to collect a specific bit of information. Like we had a project to collect marketing information on where patients heard from us. So we had a special field developed around that, and then I've written a report in order to, just monitor that field basically per patient information. And then, of course, we turn that into graphs and spreadsheets and so forth. And yeah, it's pretty similar to that pretty much for anything that we do, though. We just figure out what fields we're going to be reporting on and what is the workflow that puts the data in those fields, and then how to either identify the report in various reporting systems that's going to pull that data, or develop one, and then what kind of time commitment is it going to take to develop the report to pull that data.
Okay, so that's a good one. And if anyone has any non-EPIC Ochin members, if that's different please feel free to share. Jesse, and I'm also curious to hear, so with data outside of the EMR, so things where maybe it doesn't live within a certain data point within Epic, do you guys have a process for tracking any data outside of the EMR? And if so, what is it?
Yes, we do. We ingest data, sometimes from our CCO. There's some hospital data that's come back from St. Charles that's been extremely useful, and a lot of times what we'll do is we'll identify a key, some kind of a data key. Generally, it can be EMR or it could be MRN or something else, and then I'll basically build an Access database that will take, whatever. Usually I get a spreadsheet from somebody, and then we need to kind of compare that against some other sets of data. And we'll use an Access database, and we'll try and store everything inside of that Access database, and then run queries against it. And then, from the queries, we can generate either spreadsheets or graphs or metrics or whatever needs to be kind of brought out.
Cool. Great, thank you. Sounds very good. So anyone else on the phone would like to share their method for collecting data either within their EMR or outside of their EMR?
This is Erin from Siskiyou. I think for us a main goal is to make sure that if the data relates to the patient, it ends up in the EHR, so that almost always our first step is to figure out, is all the information in there? If not, why not, and how can we make sure it shows up? So we just went through a very, well, I guess we're not finished with it, a large project with making sure we document women's last PAP, even if we don't actually have documentation, so that there's space to say that this is when the woman said it happened, and then we can follow up or not, but at least so that there's evidence there in the EHR that we tried to collect the information where possible.
Excellent, thanks, Erin. And since you guys are on NextGen, you probably have a lot of in-house flexibility, I'm assuming?
Yes, although you always pay the price of flexibility, that it can be really hard sometimes then to find where it shows up for reporting. But we're getting pretty cagey about it, I guess.
Great. Thank you for sharing. All right, so I think we're going to probably move on to the next section, and then we've got a discussion around tracking data coming up soon. So I'm going to turn it over to Kira. Thank you, Jesse and Erin.
Yeah, thank you so much for your feedback. That was really great addition to our conversation. So right now, I want to just quickly talk about how you can follow the 5th and 6th step of analyzing and presenting your data, as well as how you can review your data and all your measures. So there are two types of data, basically. There's quantitative and qualitative data, and there's some really good ways that you can analyze each of those. So if in quantitative data, you can use a run chart, which is just a way of tracking data points and determining possible improvements that have been made along the way and how that has affected your data over time. You have Pareto charts, which is really just a fancy bar chart that helps you determine maybe the frequency of events or which specific issue might have the most impact on your process. So particularly if you're using a check sheet, a Pareto chart can be really good to determine which event might be happening most often. And then you have a histogram. And this is another bar chart, but slightly different than a Pareto chart, mostly because it determines the skew of your data. So say, for example, you're measuring, going back to my cooking dinner example, maybe I want to look at the data and determine how many times each month I actually don't have an ingredient used to cook my recipe. And is it occurring at a specific time of the month, a specific week in the month? And so a histogram would help me determine that skew and when that event is actually occurring. Then you have your qualitative data, and a storyboard is a really good way to visually represent, interviews or surveys and how people might be experiencing any particular process and any patterns or categories that may be coming from that process. And then you have a mean, median, or mode. And I like to use this just as a way to put quantitative measurement to qualitative data. So say you're using some kind of survey that has a 1 to 10 scale rating. You can easily determine through that rating scale maybe the average perception or the middle range of perceptions or possibly the perception that occurs most often. So that's a good way to kind of quantify your qualitative data. And then you have to think about how you want to report your results. So there's something called a sponsor report, and this is essentially a one-page document that you can create that has the project you're working on, the aim that you have, maybe any efforts that have been done to date, as well as the data, so maybe a run chart or a Pareto chart that shows your data collection efforts, and then maybe any barriers that your team is experiencing that the project sponsor can help with. You'll maybe do this in a team or a staff meeting. You know, again, looking at your reports, your Pareto charts, your run charts, and seeing how that data looks as a team. The team setting is also a really good time to actually review your measures. So on any specific date that you guys indicate on your data collection plan, you can sit down with your team and review your measures and see, again, where your data, what your data is telling you and where you can improve upon it. Then you have visual displays that are a good way to report results, such as project dashboards or maybe organizational dashboards. And then the last thing I want to point out is that having a standard location for your data is another way that's helpful to report, so people know exactly where they can go to find that information, such as a shared drive or maybe a SharePoint site, so that everybody is kind of aware of where that information lives. And I have this little cartoon here demonstrating that sometimes you may have too much data and it's causing you stress. You're not quite sure how to track it all or how it aligns with all of your effort. So to not feel like this guy and lose your hair, you might want to do a management report matrix. And this is just a way to list out all the measures that you have as an organization, how they're defined, where you can find that information if it's in an EMR or in a shared drive, and then how it aligns with your organizational strategy. So again, this is not particular to any specific project, but it's rather a way of tracking all the measures that you're accountable for as an organization in a simplified form. So it doesn't have all the data details, but just a simple overview of it. And we do have a template for this on our website as well that you can use and fill in. So this is where I will hand it back over to Krista for another discussion.
Great. Well, thank you, Akira. So Akira just gave a great overview on two topics. So one, visual display of data and how do we really communicate it to staff. But the second piece, which you can see right up on the screen, which I'm particularly intrigued by, is how do we track all this stuff? So all of you on the phone, you know, with the advent of CCOs, UDS has just become even more important, as you know from one of our previous things we sent out. They're incentivizing UDS a bit, HRSA. And, you know, in general, there's so much more to report and manage just in the last couple of years than there ever was before. So my question to all of you is, you know, how are you currently tracking all these different data pieces and reports that you have to run and report? Do you have a system set up? You know, how do you review them and that kind of stuff? So curious to hear the experience of everyone, and we've just unmuted the phone. Anyone like to share their system?
So this is Erin again. I have a fairly, you know, a big spreadsheet, essentially matrix 2. I mean, mine's more based on it's sort of like a combination of checklist and progress process tracker, so I can tell whether or not a report's reached the coveted automatable status, that everything's finally agreed upon, and the report system is, you know, I can just keep pushing the button every month. But most of the other things are okay. Most just listed out similarly. So the measure, the audience, how it gets reported, when it gets reported, so that every month I can go through and check them off so I don't forget. Especially the ones that are similar but different.
Has that made your life, like having one place to document and mark all this stuff, like a lot easier in your position?
It's a toss-up because honestly, sometimes I forget to update the update list. It's another essential report, essentially another report that needs to be updated, but it certainly helps communicate to people basically what's going on, and also it really helps when they see different scores for things. So when we do diabetes good versus diabetes bad. But in a lot of ways, it's just my own personal tickle file.
Hey, thanks, Erin. Awesome. Glad to hear you're using something similar already. Anyone else on the phone?
Hey, Krista, it's Vicki from Coastal Family. So I kind of do the same thing. I just have my weekly checklist, and hopefully by Friday everything's checked off of it. And then you just have to re-update it every, you just update it every Monday and hope that by the end of the week you've gotten all your reports done and presented and given to the appropriate powers that be.
Excellent. And has this same question that I asked Erin, has it really helped you in your job keep track of a lot of this stuff?
Oh, I'd be lost without it. I can't remember what I had for dinner last night, so if I don't have it written down, it didn't happen.
Yeah, I know what you mean. All right, and it looks like we got a couple more minutes to wrap up, and I want to give Akira time. So I'm just going to give a little plug. I mean, having been in your guys' shoes at one time, I can't even imagine, we were not very good about tracking our reports, and I'm so glad that I see an example up on the screen of how to do that. So, long story short, if you don't have a way to, keep track of all these different metrics and where they come from and why you're reporting them, I definitely encourage you to download the spreadsheet, take it, modify it, and make it work for your needs. All right, thank you. So take it away.
So I want to leave some time for Q&A, so I'll just discuss these last couple slides real quickly. The last step to your measurement process is to repeat, and this is particularly important if you're doing an improvement project. So you have your and with your baseline, and then you have then you want to repeat that. So once you've reviewed it, analyzed it, presented it, then you want to repeat it and see if any of your improvements or efforts have actually had a positive impact, or maybe a negative impact and it's actually worsened your results. So that would be a time where you would want to repeat. But if at any given point you review and realize that you've actually met your aim, you might not need to actually do this portion. And then just quickly a summary of the tools. We've talked about a lot, different data collection methods, the 7 steps to measurement, value stream mapping, decision matrix, different data collection sheets, different analysis tools, and ways to report and track your data. Please don't hesitate to contact us if you have questions, or poke around on our website and download any of the tools. But for now, I want to just leave a few minutes for Q&A before we wrap up. Are there any questions that haven't been addressed?
The line is unmuted.
You are unmuted, so feel free to shoot away with your questions. Okay, well, if anything comes up, again, feel free to contact us. I want to thank you all for calling in and bearing with us through our technical problems. We will be sending you a feedback survey as well as the slides, and then, again, I will be sending that video that has the information on the decision matrix. So all of that will be coming in a follow-up email. And I hope you guys have a great day.
Thank you. See you guys next month.
Thanks.
Bye.
Bye.